On the phone with me, I have Dr. Jason McKillop from BreastLink, correct?
That's correct.
Perfect. Let's talk about the mission of BreastLink. What's BreastLink all about?
So BreastLink can be thought of as kind of a one-stop shop for breast health specifically. We do screening mammograms here, so we image the general population, women above age 40, screening them for breast cancer. And we also see patients with breast complaints. So if a woman feels a lump, she can come in, get her imaging study done. And the convenient thing about such a quote-unquote one-stop shop is that you can have all your imaging studies done at the facility, but also see providers that are specialized in breast health specifically. So we're affiliated with a breast surgeon, for instance, should a woman need breast surgery, that is available to her. And we're also in the same building as medical oncologists and other medical professionals that may be of service.
Perfect. So this really encompasses everything that you need for breast health. So let's talk about mammograms and how often women should get one. Let's talk about the basics here.
So mammograms should be obtained on an annual or yearly basis. When a woman of average risk turns 40, she should have a mammogram yearly from that point on. In some instances, women with a high risk or increased risk of developing the disease, they may start screening at an earlier time point. But once you start screening, it should happen on a yearly basis.
Now, especially during this time of a pandemic, is it appropriate to get a mammogram during COVID? Should they go get a mammogram during COVID?
Yeah, it's the answer to this question, unfortunately, is a conditional one. Mm-hmm. I think women should continue to get scheduled mammograms if the conditions are appropriate and safe for administering the exam. Obviously, because of the pandemic, it is less safe now than it was this time last year to venture out in the world to do anything, much less getting a medical examination. But there are health risks to staying completely sheltered as well, especially as it relates to screening exams such as mammograms. As we learn more about the transmission of COVID, we're able to adapt to the threat of the infection by taking certain precautions that make the environment safe for our patients.
As far as women who do already know they have breast cancer, is it safe for them to get one during COVID, get examinations and procedures done during a pandemic such as COVID?
Right. So patients with breast cancer should not delay their imaging evaluation or their treatment of the disease, because we know that the morbidity and mortality associated with breast cancer are time sensitive. And what that means is basically there are greater complications and a higher rate of death when patients prolong their treatment of disease. So women with known breast cancer should absolutely continue to get necessary imaging and treatment for the disease. Basically, the earlier one can detect and treat breast cancer, the higher the chances of successfully treating the disease and surviving.
Now you're talking about imaging. As far as getting a mammogram, is there a difference between getting a mammogram and another procedure such as an ultrasound?
So the two types of examinations, mammograms and ultrasounds, they're supplemental studies. They both can have benefits in the setting. Mammograms are the staple kind of bread and butter screening modality. It's the one that's gone through rigorous clinical trials and has proven to have a benefit for the screening population. And that benefit is about a 40% reduction in breast cancer mortality or breast cancer or mortality caused by breast cancer. So mammograms are the bread and butter screening utility. Ultrasound is a supplemental screening tool that's used in dense breast tissue. Women who have dense breast tissue can benefit from supplemental screening with ultrasound. In addition, it's an adjunct to the diagnostic mammography workup when we're looking for things such as lumps in the breast or we're trying to problem solve. Ultrasound can be very useful in that setting as well.
So you would say, doing both procedures can really complement each other and just be kind of like, it would go hand in hand more so.
Absolutely. But both studies and both technologies are beneficial. And complement one another, like you said.
Perfect. Now, Dr. Brestlink, you guys also do essential imaging. Talk about what essential imaging is.
So essential imaging is essentially a term that we use to describe radiology imaging studies that are of a time-sensitive nature. It's not unique to breast imaging. It's just something that has kind of a time urgency or component to it. So this would include imaging studies that if the patient doesn't get it in a timely manner, then their morbidity or mortality, the complications or rate of dying from such an undiagnosed condition will change significantly. So that's kind of what we refer to when we say essential imaging.
Is there a point of time where a woman should stop getting mammograms at some point in their life when they reach a milestone? Is there any point in time where they should stop getting mammograms?
That's a very interesting question and a very common question among our patients. There is no defined age or time period that we indicate women should stop getting mammograms. In fact, if a woman's happy and healthy, regardless of what age she is, including beyond 100 years, if she's happy and healthy and has a life expectancy greater than 10 years, we expect them to continue getting mammograms. But obviously, this is a conversation that needs to be had with the referring clinician, the patient's general practitioner, to assess really how what the life expectancy of the patient is. If the patient is older and has multiple medical conditions, it may not benefit them to get a mammogram given the underlying medical condition or the presentation of the patient. But as long as the patient is happy, healthy, and a life expectancy greater than 10 years, we expect them to continue getting mammogram screening.
So pretty much when it comes to mammograms, it's very low risk. There aren't many issues when it comes to getting a mammogram, right?
Mammograms, unlike ultrasound, does have radiation exposure associated with it. It's a very small dose of radiation that's associated with the exam, so small, in fact, that I would recommend it to family, loved ones, and friends alike without reservation. The amount of radiation that's associated with a mammogram is about the equivalent of existing on Earth for 7 weeks. There's background radiation as you walk around on Earth, and getting one complete study is the equivalent of just existing and breathing the air on Earth for 7 weeks. So it's a very low dose of radiation, one that does not have any untoward effect.
And that's part of the reason why mammograms are usually an annual thing, not so much twice a year thing, right? Because getting more mammograms doesn't really help either, correct?
Yeah, so the interval at which we get mammograms is a specific one that's been kind of tried and tested through clinical trials to confer a benefit to patients. And a yearly basis is a time period in which we expect to see changes on the mammogram. An analogy for this would be if you and I walked outside and you asked me, Jason, what is it going to rain today? And I would probably tell you, check back with me in a couple hours, because if you checked every minute, you wouldn't see the clouds developing in the sky, and you really have a good assessment. So you have to have a certain time interval in order to see changes, and that time interval is about a yearly basis.
So a screening every 6 months really won't show much of a difference versus the yearly, annual, normal time frame between mammograms.
So it's a sweet spot for screening. You mentioned 6 months. 6 months is a short interval. When we look at a finding that has a less than 2% chance of being malignancy, we do actually recommend a 6-month interval as a short interval. So these are people that we're scrutinizing more closely.
Okay.
But the screening interval is 1 year. When we want to do a more close interval follow-up, we do choose 6 months, actually. But that's when we're following a specific finding, not screening.
Right. So it's a case-by-case basis when it comes to that stuff with the 6-month intervals.
Precisely.
Okay, now let's talk about your actual offices. What safety measures are you guys taking to make sure every patient's safe, especially during a time of COVID-19 and the pandemic? What safety measures have you put in place in your offices?
So in light of the pandemic, we've taken several steps to help mitigate the spread of disease, and we've gone beyond the universal precautions, which include the regular hand washing, sterilizing of equipment, and the social distancing rules that we're all in society trying to adhere to. Some examples of what we're doing include an open door policy. When you enter our facility, a patient will notice that the majority of the doors to enter and to transit through our facility remain open. And this helps to cut down on the transmission of droplets from one patient to the next from door handles. These open doors also help with cross-ventilation. Patients also have an opportunity to wait in their cars until their appointment time is ready in a so-called virtual waiting room. So when they do arrive in the actual physical waiting room, they'll find that the seats are limited and the space to allow for adequate social distancing. But this is kind of a new evolution where patients can wait in the comfort and safety of their cars before their appointment time. We've also reduced the amount of physical paperwork and charts that exchange hands between patients and staff, and we've maximized the amount of electronic telecommunication to try to facilitate provision of appropriate care without having to exchange hands of paperwork. And we enforce the use of masks among patients and providers and staff, among countless other things that we've modified to our practice to make sure that it's a safe environment for patients to transit in and out of.
You guys have it pretty much under control at the offices. Well, thank you so much, Dr. Jason McKillop from BreastLink, talking about breast health and getting mammograms yearly. Anything else you'd like to add before we go?
Well, I know it's said quite frequently that we're all in this together, and that phrase may get overused, but I think there is some truth to that, or there's a lot of truth to it. We are all in this kind of circumstance together, and I think we'll get out on the other end better for it. I've cited some examples of the evolution that our practice has made, and I think some of those changes will probably stick beyond the pandemic, because we've seen some benefit to some of the changes we've made.
Absolutely.
And I think to a greater extent, society may see greater benefit to the trials that we're suffering through at the moment.
Wise words right there. Dr. Jason McKillop of BreastLink, thank you for spending the time with us and educating us about breast health and mammograms.
Thanks for having me. I really appreciate it.